Other council members attending, they should be here hopefully next few minutes. So I'll just start the committee, and I know we have several guests here, and I don't want to keep you waiting any longer than you have to. Welcome to the Edward R. Roybal Public Works room. As you know, we have a few housekeeping things to share with you. One is that when you come up to the microphone, please give us your name and address. If you look to your right, there should be a clock there. Good. And if you keep an eye on that clock, that will be for your public comment. I know many of you have written a very eloquent letter, but with the time that you have, let's make sure you get to your point. Sometimes folks write 2, 3, 4-page letters and they don't get to their message, so just encourage you to do that. If there are public speakers before you and they've already stated what you wanted to say, it's okay to say I agree with the previous speaker. If there's anything new you want to add, let's hear that. So I'd appreciate your cooperation there, and as you can tell, the acoustics are not the best in this room, so we need you to speak into the microphone, and if you are carrying conversations, please take them outside. It's hard to hear the individual speak, and the audience is hard to comprehend at times, so we appreciate your support there. That being said, we can start with the various candidates who have been appointed by the mayor to join the various commissions. And before us, on item number 1, we have Mr. Franklin Acevedo, otherwise known as Frank.
Yes.
Good afternoon, sir.
Good afternoon. Franklin Acevedo, 2404 Wilshire Boulevard, 8A, Los Angeles, with a home overlooking glorious MacArthur Park. I just wanted to take a moment to seek your support for my appointment or reappointment to the Central Area Planning Commission. It's really been an enjoyable time thus far, and I think we, as a commission as a whole, represent the community very well and have a very fair and balanced meeting sessions, and are very cooperative with each other, as well as making sure that we exercise our due diligence in reading all our materials, which is sometimes quite extensive, but we do our best. And I would respectfully seek your support for my reappointment. Thank you very much. And I'm here to ask any questions if you have any.
Appreciate you taking the time. Please stay there for a second. We have some questions for you. Come on up. Just stay there.
Thank you.
Well, I want to thank you for your service. I know you've been a long-term supporter of various issues in the community, and I thank you for your work around MacArthur Park. I think you probably landed one of the first adaptive reuse units around the park, and I understand you have a great view. But if there's something you wanted to walk away with as a commissioner, what would that be?
Well, I think the greatest challenge that any commissioner faces is the focus, I think, that is seriously required of every person that volunteers their time in any civil service job. But I think if I can walk away with anything, it would be to know that I have given everyone the opportunity, and every constituent in the city the opportunity to be heard and state their case and make their case, be well represented, and have an opportunity to have us exercise our discretion to be able to assist them in any way we see fit. And that if I were to ever see this constituent anywhere within the city limits, that I would be able to come up to this person and shake their hand and know that I was fair and balanced in hearing their case.
Okay. Well, we've been joined by Councilman Jose Bizarre and our newly elected Councilman Paul Koretz. Welcome, gentlemen. Before us is Mr. Franklin Acevedo, who is being reappointed to the Central Area Planning Commission, and just gave us his perspective and insight as to becoming a commissioner. Any questions from my colleagues for Mr. Acevedo? None. I'd like to move that we recommend Mr. Acevedo to the Central Area Planning Commission. Have a second on that? Second, so moved. That'll be action of this committee, and Barbara, do we have a day for him in council?
His date is for next Wednesday, July the 15th.
July 15th?
Yes.
And all the city ethics forms have been filled out, I'm
We are
assuming?
getting them in, and we haven't logged in each and every one, but if he's
Okay.
submitted them, we'll have them a note, so in the committee report.
Great. Mr. Acevedo, thank you for your time
Thank you all for your support. Thank you very
and
much.
your hard work.
Thank you.
Thank you very much. Our next item, Roberto?
Council members, the next item is item 2. It's communication from the mayor relative to the reappointment of Mr. Sean Burton to the City Planning Commission.
I think Mr. Byrne has been coming before us a couple of times at least.
It's number 5.
So, reappointment to the City Planning Commission, correct?
Correct.
So how long has it been now that you've been on the City Planning Commission?
It was confirmed on the 22nd of January, so it's been about 6 months.
6 months.
But who's counting?
Is it what you expected?
It's more than I expected, actually. I've enjoyed it a lot. First of all, I just want to thank you for considering my reappointment today. I want to welcome Mr. Koretz as a constituent of the 5th Council District. And I want to thank Director Goldberg and the staff. I particularly enjoyed working with the planning staff. I worked with them when I was on the West Los Angeles Area Planning Commission, but much more extensively on the City Planning Commission, and it's been a terrific experience and a lot of work. So.
Great. Are there any policies or discussions that stand out in your mind that you would like to share with us that has been relatively striking to you in these past few months, or is it something that we have yet to see?
I think particularly enjoyed working on the sign ordinance. We put a tremendous amount of effort in. The planning staff did a Herculean job and effort of bringing that forward, and we worked hard to forge a compromise. There's a lot of kind of vested interests around town with a passion for the issues, and we worked really hard to create a balanced and comprehensive proposal. So we're looking forward to that going through the council and being signed by the mayor at some point.
Yeah, we can hardly wait too. Colleagues, any questions for Mr. Byrne? Any comments? Well,
Thank you.
all right. So that's a motion to appoint Mr. Byrne to committee, correct? You have a movement? That's a second. That'll be the action.
All right. Thank you for your time.
That'll be our action. Thank you very much, sir. Next, Roberto?
Council members, it's item 3. It's the reappointment of Ms. Faith Mitchell to the South LA APC.
Good day, Ms. Mitchell.
Good afternoon. My name is Faith Mitchell. I reside at 3852 Wellington Road, City of Los Angeles.
That happens to be District 1, doesn't it?
I'm in District 10.
10?
10.
10, okay. They got me wrong here then. Thank you again. This would be for the South Los Angeles Area Planning Commission, a reappointment?
Yes, sir.
So how many months has it been, or years?
It's been 2 years and almost 6 months.
2 years and 6 months, and you look so ecstatic.
Well, we have a meeting at 4:30 this afternoon, so I have prepared.
Okay. Well, is there any comments you'd like to make and observations to the committee?
Nothing that hasn't been said before. It's been wonderful working with the planning staff and certainly working with the director, and everyone works real hard. So I have started looking at things I can take off my plate, but needless to say, I've decided to keep this.
Great. Well, thank you so much for your hard work and your service to the city of Los Angeles. I'd like to move that we reappoint Ms. Mitchell to the committee. Okay, that'll be the act of this committee. Thank you very much.
Thank you very much.
Thank you for your hard work. Next, Roberto.
Item 4, council members, this is a reappointment of Ms. Erica Teasley Linick to the West LA APC.
Hi there.
Hi, good afternoon.
Good afternoon. So this would be for the West Los Angeles Area Planning Commission. It's also a reappointment.
Yes, I've been a commissioner for almost a year.
A year?
I was filling the balance of another commissioner's spot.
Wow. So this is a very active area.
It is, and when I was before your committee the last time, I think former council member Weiss made quite a face when. Oh well, good luck. But it's been really interesting. It's been challenging. I've really enjoyed it. I've lived in West Los Angeles for a while, and I went to school, elementary and junior high and high school adjacent to the area, and so it's been, I think, great being on this side of thinking about development there, thinking about what the community wants, and thinking about how to make it a better place. So it's been great for me.
Is there one item that is most controversial in your mind, or exciting, or that jumps out at you, given your experience there?
Well, I'm a Venice resident, and Venice conjures up a lot of images in your head when you think of Venice. From Muscle Beach to rollerblading, and you think of stunning architectural homes, and Frank Gehry bought a 3-parcel lot that's about a few steps from my home in Venice, and it's still undeveloped. I'm not sure what's going on with that, but it's it's very exciting. I think everyone wants to build there, people want to live there, and there has been lots of debates. And being a person of Venice and watching my community council, the neighborhood council is really active there, and they take all the development seriously there, and come and make sure that the community's voice is heard. We hear from the developers, we hear from others in the community. I think it's been very exciting being a resident of Venice and having 2 young children there, and wanting to make sure that Venice sort of retains its character, whatever that is. And then also, moves
I am the beholder.
moves forward with new and exciting projects. So that, I think, has been really exciting for me.
Well, again, thank you so much for your hard work. I know you're logging in a lot of hours, but I do truly appreciate all your effort. And any comments from my colleagues?
Thank you for your contributions here, and also at UC Berkeley. Roberto, our Go Bears, Go Bears.
Go Bears.
He's a big Bear fan here, so
Yeah.
I know you were active back then, giving back to the community. When you were even a student at Cal, you're still doing it here as a citizen of LA, so thank you so much.
Thank you. Excellent.
So the Bears are hanging tough. They're holding on tight. So.
Yeah, we have good rankings for both football and basketball this year.
Right. Okay, well,
I went
thank
to
you.
the Emerald Bowl.
So, thank you so much. I do believe we have a comment card on this item. So, I'd like to, before we act, we'll call up the speaker who wrote this card, and it's hard to read the name. I believe it's WMNGO.
Zoom it out.
Okay, that's what that says. Go ahead, sir.
Yes, thank you. I would just like to warn the people here as far as the mayoral reappointments of commissioners. There's been scandal throughout the country regarding the commissioner appointments from the mayor. You've heard Attorney Andrew Cuomo in New York City regarding Weatherly Capital. That was regarding pension commissioners. So please be very aware. I personally would like a moratorium on all reappointments of commissioners until until some of these investigations are done. So just to be brief, please be very careful of the commissioner appointments that you are doing here, because what happens is I always end up reading in the LA Times about scandal and investigations, and be very aware. Thank you.
Thank you for your concern. Any comments from my colleagues? I'd like to move that we reappoint Ms. Lennox to the West LA Area Planning Commission. You have a second? The second moved. There'll be action on this committee. Next.
That would be item 5, council members. It's the reappointment of Mr. Richard Lehner to the North Valley APC.
Good day, sir.
Good afternoon, folks.
How are we doing today?
Fine. It took me 20 minutes to park downstairs, so I just made it.
Okay. Well, we bought you some time here with these deliberations. This would be for the North Valley Area Planning Commission.
Yes.
This is a reappointment as well.
Yes, sir.
And how long have you served so far?
I think it's 2 years. I think I
2
came in
years?
return for somebody.
Great. Well, I want to thank you for your service and your hard work.
Thank you.
Is it what you expected when you joined this commission?
Excuse me?
Is it what you expected?
Actually, I expected to be a little busier, but I think the economy has slowed us down a little bit.
Okay. Any comments from my colleagues? I'd like to move that we reappoint.
There is a speaker card on.
Oh, that's right.
Yeah.
Okay. Hold on, sir, and we'll ask for our speaker to come up to the microphone.
Sure. Should I sit down, sir?
Yes, please.
Thank you.
Thank you, sir.
Yes, it's still pending. I might provide some testimony to sway them to a no vote. But I'm not really here to do that. Just to caution, again, about commissioner appointments that come from the mayor's office. I believe that City Hall is being investigated by U.S. President Barack Obama over the decisions and actions of the commissioners that you people approve. So, you can all be caught up in this, so just be very prudent. Now, regarding this specific planning commissioner, I would like to make them aware that the planning department is great. They come up with all the rules and regulations, and then city council sits here, and if the right person has the right connections, well, there's variances, exemptions, they'll basically turn a blind eye and let anything happen, and let you weasel out of anything, and just, it's anything goes, and we've seen the result of that. So I'd like there to be a concerted effort on council's part to please pay attention to the things that the planning department puts in front of you. They're the experts. They're the ones that have done the studies. Also regarding EIRs, I don't like when it's weaseled out of when, when it should be. So please pay attention to the good people that do such good work, who are so smart with so much knowledge and research in the things they tell you to do, because I'm here to say I'm concerned of too many variances, exemptions, and just look the other ways. Thank you.
Thank you very much. I'd like to move that we reappoint Mr. Richard Lerner to the Beverly Planning Commission. Have a second? I'll be seconded. I'll be action of this committee. And thank you, folks, for taking the time and serving the city of Los Angeles. I appreciate you, Mr. Lerner, for all the hard work that you do.
Thank you. I'd like to say hello to Gail, who I haven't seen in a while. Nice to see you, dear. And Paul.
Thank you very much, sir. Thank you. Okay, Roberto, let's see. We do have item number 6. I believe we'll be continuing number 6 till July 14th, and hopefully in council on July 22nd.
Yes, sir.
Item number 7, Roberto.
Item 7, council members, is a DWP board report and a city attorney draft ordinance in establishing water efficiency requirements for new developments and renovation of existing buildings in the city.
Good afternoon, sir.
Good afternoon. My name is Jim Caldwell, and I'm the Assistant General Manager for Environmental Affairs at the Department of Water and Power. And I'm here to advocate adoption of a new ordinance to mandate high-efficiency plumbing fixtures in the city of Los Angeles. Now, the last time that the city faced a significant drought or a significant reduction in water supply, mandated rationing of water, was 1990. And in that year, a plum committee met and also passed an ordinance mandating high-efficiency toilets to be put in the city of Los Angeles. And through that ordinance and through the Department of Water and Power's rebate schedule to try to increase the penetration of those high-efficiency fixtures, we today serve 1 million more customers with the same amount of water that we did 20 years ago. And we're here to do it again. We're here to ratchet up the standards for plumbing fixtures in the city of Los Angeles, and we're here to lead the city, the state, and basically the country in adoption of this ordinance. What the ordinance would do is to accelerate 2014 state standards for high efficiency fixtures, and it would also make those apply to renovations and retrofits instead of simply new construction. And it also pushes those 2014 standards in the area of urinals to 1 pint per flush urinals or less, that is waterless urinals, instead of a half a gallon per flush, which is in the 2014 standards. This was a collaborative effort with the Department of Water and Power and the Department of Building and Safety and the Bureau of Sanitation. And I want to commend both the Building and Safety and Sanitation folks for their cooperative efforts with us on this ordinance. What it would save: we will reduce through this ordinance residential water consumption by approximately 20%, commercial water use by approximately 30%. If and when the building stock in the city were to turn over, that would save roughly 60,000 acre-feet per year of water. That's enough for 120,000 households to be added to the city. This ordinance for new construction in our rebate schedule to incentivize people to undertake renovation retrofit simply to save water. We feel within 5 years we can save 15,000 acre-feet or enough for 30,000 households simply with this ordinance. We've been asked in the past about the costs, and so we put together a table for you. This table shows the cost of the new fixtures. And one thing I think you need to keep in mind is that there is no inherent per se reason why an efficient fixture should cost more than a non-efficient fixture. They're all made out of vitreous china. They're all about the same weight, and they will have in commerce roughly the same price or the same cost. So it's a supply and demand issue. New products with few suppliers will be higher priced than old products that are being discounted. So it is our job to try to put together a rebate schedule and to try to increase the commercialization of these fixtures in order to push it through. If you look at the second to last column, through our rebate schedules, you can see that someone who is undertaking new construction or a renovation and retrofit that requires replacement of these fixtures, that they will see a savings from this ordinance and our rebate schedule from what they would undertake to put in a less efficient fixture. The last column shows what you would find if you simply undertook to replace the fixture simply to save on your water and on your sewer charge. And you can see there that for the water closets or for toilets, high-efficiency toilets, the payback is fairly long if all you're doing. And that's because, again, that ordinance that we passed 20 years ago, that the toilets in this city are fairly efficient to start with. So the incremental savings in water are less than what we would get from the urinals. If you turn the page, you can see what we're trying to do about that. And what we're trying to do is trying to develop products that reuse the bowls from the old toilets, retrofit them with new mechanisms which save the water, and through that process incentivize people to make that savings. There are a couple of these fixtures that are in commerce today. We're working hard to try to make more of these available and to try to get the price down and the availability up. But that's the way we can actually achieve the savings from the toilets. Thank you.
Thank you. And the driving force behind this is obviously the drought that we are right now in the middle of. And this is another approach in trying to do everything we can as individuals to address this crisis that we're in when it comes to our water shortage. So for that, I thank you. Colleagues, we do have an ordinance that needs to be presented by the city attorney's office. What I'd like to do is maybe call out the public comment cards, and then we can ask for you to come back after public comment. And then we'll have the ordinance presented to us, then we can ask questions so that we can hear from Department of Water and Power, from the public, and the city attorney, then we can raise the questions accordingly. So that being said, you just keep an eye on the clock. You got 2 minutes. We have David Oderstein, Jerry Desmond Jr., and Roger Lightheart to begin. Good afternoon, sir.
Good afternoon. My name is David Otterstein, Piping Industry, Progress, and Education. Thank you for allowing me to speak this afternoon. The piping, plumbers and pipe fitters industry stand in support of this resolution or changes to the resolution. We've installed plumbing fixtures and plumbing systems in Southern California and Los Angeles area for well over 100 years. We are skilled craftsmen and skilled contractors. But without having the language laid down as installers, we can only put in what the end user requests us to put in. So this language will help us move forward and be move forward with the conservation that the Los Angeles Basin needs. It's very important, and we're looking to our future children and families coming behind us to have the same life that we've had and I appreciate you letting me speak. Thank you.
Thank you, sir.
Mr. Chair, could I ask a quick question
Sure.
of the Speaker?
Let's come on up. They have a question for you.
Yeah, I know historically over the years, pipe fitters have been strongly opposed to waterless urinals. What progress was made to change that?
Well, we've created a relationship with the waterless urinals, and, times have changed, and we need to, this isn't just about solely waterless urinals, it's about conserving water. It's up to the end user to dictate if he wants waterless urinals or just low flow. So we have kind of made amends with those people with the waterless urinals. It's up to an end user. But if you don't have the language in place, then we don't have the muscle to install low flow and economy fixtures, because people will. You know how we are. We want to use as much water as we can. So if the language isn't there, then we just can't move forward on our end as installers and contractors.
Great. Thank you.
Yeah.
Thank you, sir. Our next speaker is Jerry Desmond Jr. Then we'll have Roger Lightheart. Good afternoon, sir.
Good afternoon. Jerry Desmond Jr., 925 L Street, Suite 220, Sacramento, California, 95814. And I'm here on behalf of the Plumbing Manufacturers Institute, or PMI. It's the International Association of the Manufacturers of the high-efficiency toilets and urinals, including the brands Toto, American Standard, Kohler. About 75% of the marketplace is represented by the membership, and we've been working together with the Department of Water and Power to address a number of issues that are now reflected in the current draft in terms of transition, time frame, specificity to the ordinance, so that the manufacturing community will be able to manufacture the product. We were also the sponsor of the provision of the state legislation that provided a 2014 date for 100% compliance with HETs, HEUs on a statewide level. The one provision that we're committed to work with the city on as it moves forward is that we can't ensure that with the aggressive time frame that's in the proposed ordinance, that there will be a sufficient amount of competitive product that works in the marketplace. But we're committed to work with the city as this ordinance moves forward and is implemented to make sure that it'll work for the community.
Any questions? Thank you. Mr. Lightheart?
My name is Roger Lightheart. I'm a plumbing mechanical contractor here in Los Angeles.
Good afternoon, sir.
Thank you. It's a pleasure meeting you. And my family's been involved dealing with the city of Los Angeles, mostly the building department, for nearly 100 years. And I'm just prefacing my other comments by one of our other speakers earlier. The city of Los Angeles has all its many functions. There's always been just what can be done for the general public as a whole to better our environment, and particularly the building department, which I'm very much involved with as a contractor and having to deal with them. They've always told me where I stood. If I didn't like it, I found a legitimate alternate way of doing it. And anyone that's self-serving stands out of the crowd. Everyone else is there to serve you. So that's my compliment and how well the city does. And the waterless urinals, I wrote a letter to the Department of Water and Power, addressed it to Mr. Caldwell back in February, trying to gain influence, or not influence, that's the wrong word, but input on the application of the Water Conservation Ordinance. And you asked about the waterless urinals, and I wrote, "It is a pleasure to learn that the department is taking the initiative to encourage the development and installation of plumbing fixtures that will use water in a safer and more efficient manner than what is presently available. However, we do implore that the department use its engineering prowess, perhaps with the input of the Los Angeles City Testing Lab, to allow the sale and installation of performance-proving plumbing fixtures only. Our service calls on ultra-low flush toilets and waterless urinals has increased substantially. Unless they train, and particularly with urinals, waterless urinals. Already?
Yes.
Unless a trained custodial staff is available to maintain these fixtures, the result is an unsanitary and putrid condition."
Thank you, sir.
Obviously, I'm very much in favor of this ordinance.
Thank you very much. We have Jason Fallon and Will Wright, and then Zuma Dog.
Good afternoon.
Good afternoon,
My name
sir.
is Jason Fallon. I'm the chairman of the West Los Angeles Green Committee. And the point of me coming here today is to bring this to the attention of everyone in the room. This is called the Echo Flusher. It is a retrofit kit. It fits in any standard two-piece toilet. It fits 5-gallon toilets, 3.5-gallon toilets, as well as 1.6-gallon toilets, and it will turn them into a high-efficiency toilet at 1.28. The reason that this is so important is because the cost is low, and it's bringing the water down to a level where a lot of these toilets that are out there at 1.28 aren't even performing correctly in the first place. They're very expensive, and there's also installation costs. So for your average consumer in a market out here at single-family residence, this is a $40 product that will bring your toilet to 1.28 without having to buy a more expensive toilet, without having to get the installation costs, and you're going to get the exact same results. So, we've tested this through DWP. We've passed our 2-month pilot program. It's gotten high acclaim. We have our UPC certification as well as our Atmos certification. And we think this is just a great solution. You know, your average family of 3 people, which is the average residence amount of people in a home in Los Angeles, you can save about 20,000 gallons of water per year, and you can save about $96 a year. So it's a perfect timing for something like this, and I think this is one of the better solutions out there currently.
So was this, Mr. Fallon, a 2-minute commercial?
You have to.
Is that what we just heard?
You'll have to excuse my political inexperience and my environmental enthusiasm.
All right. I just want to be clear with what I heard here. All right. Thank you very much.
I appreciate your time.
All right. Have a good day. Mr. Wright?
Hello, good afternoon. My name is Will Wright, and I'm here with the American Institute of Architects to register our Board of Directors' support for this ordinance. And I'm going to submit the letter that we submitted to Councilmember Perry as chair of the Energy and Environment Committee. And I also just wanted to say primarily we're grateful that Amir and the Department of Water and Power included AIA in this in the discussion of this ordinance. And they sought early advice from our Committee on the Environment and our Building Performance and Regulations Committee. And we were pleased to have that dialogue and feedback. So, thank you.
Thank you, Mr. Wright. And our last speaker? Mr. Dog?
Yes, that's Zuma Dog for the record. Yes, when talking about water conservation, I'd like to say that I think there's a big scheme by DWP and the city of Los Angeles to purposefully keep this water crisis here. There's things they could easily do to improve the water flow, to have more water available. It would drive the rates down so low, but why would DWP want to do that? They want to take in as much money as possible, and then I heard there's illegal transferring of DWP money into the city of Los Angeles, and that just went down for the record. Things like desalination, I heard it easily could be done and is very cost effective in the long run once the plants are created. And we have a water source just not too far away. It's called the ocean, so we should be doing desalination. Also, I'm told that reseeding the forests could be quite good for helping to increase water. And then you have the pipes that you take, and you can have the drainage run. And I understand that DWP is sitting on just boatloads of water over there in, what's that, Owens Valley or something like that, and, you know, they just keep it on reserve. And so I'm just here to say is nothing more than a concerned citizen. Sure, I carry a huge constituency. Sure, I ran for mayor with no money. I just put my name on the ballot, didn't even put out a flyer. I received 9,100 votes and came in fourth, and the mayor had to spend $3 million to beat me. Sure, but I'm just merely here speaking as a concerned citizen. And I'd like to say, I'd like to see DWP and the city do more regarding desalination, regarding reseeding of the forest, regarding taking the drainage through pipes, and regarding letting some of the water they got in storage. Not to mention Vivendi. Not to mention Vivendi. And boy, oh boy, I'd just like to say for the record, Greer Davis, Dan Weinstein, Weatherly Capital, how dare you purposefully create this? How dare you ignore everything Rod A. Smith said in his white paper that warned of this crisis? There will be hell to pay, people. Thank you. My name's Zuma Dog.
All righty. That is concludes our public hearing for number 7. Madam City Attorney, are there any questions for, please come on up. Any questions for our staff? Department of Power, any questions? Seeing none, there was one mention from one of the public comments that the notion of competitiveness and having access to these, the apparatus and the various, can you speak to that in terms of how that was dealt with?
Yes, certainly that played a big part in our timing of this ordinance. First of all of these products are commercially available and certified today. Okay, so it is not, but one of our objectives was to make sure that they were not just commercially available, but they were competitively available. That is, that there's multiple suppliers. And so that we worked very hard, and particularly Jerry Desmond spoke about the timing of the ordinance, and certainly we pushed the manufacturers hard to make sure that we had multiple manufacturers of each of these products, and that they were all commercially available, that they were all certified, and that there would be a competitive marketplace. One thing I would point out is the first place that we tried this ordinance out was on ourselves. We've completed the John Ferraro building and also the building complex out in the valley called Truesdale, and also a couple of our power plants. And so we've tried these fixtures in our own buildings. We've purchased them through commercial means, and we've verified all the cost numbers and the commercial availability in that way. We're proceeding with the rest of our facilities. We've also completed all of our customer service centers have been retrofitted with these fixtures. So that set the timing for this, and that's why we set December 1st of this year for most of the ordinance, and why we waited until October the 1st of 2010 for the 1-pint urinals.
Thank you, sir. Madam Attorney, the presentation of the ordinance, and can we speak to that, please?
Jerry Burge, City Attorney's Office. The City Attorney did approve this ordinance as to form and legality, and there are no remaining legal issues.
Okay. So that being said, do we have an action to move on this item, council members?
Move the item.
Okay. Do we have a second?
Second.
So that's been moved and seconded. That will be the action of this committee to approve the city prepared ordinance, and we can move this item on to city council. I'd like to ask our director of planning if she can give us her report. And thank you for your patience.
Thank you very much, Chairman Reyes. I'm particularly pleased to be here today when we have appointed 5 planning commissioners, reappointed 5 planning commissioners. These are all wonderful commissioners who are known quantities that have added great value to the commission, and so we're very pleased that they were willing to volunteer and to continue that work. I also wanted to let you know that we have, as we have explained to you before, one of the highest priorities of the planning department are new community plans. And we wanted you to know that we have very recently posted the preliminary draft of the Hollywood Community Plan online, and we are beginning now the review of that plan, and we are extremely pleased. All of the chapters of the community plan are online with the exception of the public facilities chapter, and that will go online at the end of this month. This is the beginning of the commitment that I had made to you that we would bring forward during this fiscal year at least 4 and hopefully 5 new community plans for approval. I also wanted to tell you that the planning department over the past 3 weeks has received 3 awards that I wanted to report to you. The Local American Planning Association has awarded local awards to the City Planning Department for our density bonus ordinance and also for the Downtown Street Standard ordinance that went forward. And also we received from SCAG one of their Compass Blueprint Awards, and in fact it was the highest award that they gave. The President's Award for Excellence went to the Planning Department for the South Park development and specifically for the work done with the South Group. So we are very pleased about that. I wanted to say how pleased we are today to welcome our new council person, Council Member Koretz, and the Planning Department is looking very forward to working with the council member to meet the needs of the community. So we're looking forward to a very productive relationship. So thank you.
Thank you, Ms. Gore, for that work, and it is crucial that we stay focused on those new community plans. As you know, for decades, in certain instances, these areas were not given their proper review of the planning discipline to deal with the density issues and all the other factors that influence quality of life. So we appreciate the work that's being done, and hopefully we can get that done.
I think we've talked about before that the old community plans are typically very short documents, 15, 25 pages, not very complex. I want you to know that the Hollywood Community Plan, which is not exactly our brand-new model since it had started before, but is sort of a hybrid, but the community plan is a complex plan that has about 200 pages, and we think really cover the issues that are important to guide development. So we're hopeful that the community will be excited about the prospect of having better plans.
Thank you, Ms. Goldberg. Any questions or comments for our director? Seeing none, we have, again, thank you for your presentation and look forward to the next report. What I'd like to do, colleagues, is if we can go through the agenda and see which ones are consent now that we have a full quorum, and that way the staff will know which items we can move on. I believe at number 8, we don't have a card on that. We can move on that as a consent item. Number 9. Number 10, we can move to approve the ordinance, seeing no cards. 11, we can request the city attorney to prepare the ordinance for that action. For 12, we can move that on consent. 13 and 14 are special. 15, we can continue to July 28th. 16 to July 28th. 17 to July 14th. We just heard from the director's report. And 19, we will have special. I believe that's in closed session. Okay. So we can have a second on those items. We can move on those items on the agenda. Second, so moved. So that'll be the action of this committee. That takes us to, I believe, item 13, maybe, Roberto? Yes. Okay. Can you please read 13 into the...
Yes, what's before you is a status update from various city departments as it relates to a proposed medical marijuana ordinance in the city.
Roberto, I believe I need to, my apologies, on item number 9, we do have some cards on item number 9, and that's my error. So we can go back to item number 9.
Yes, Councilman. Item 9 is the report from the Planning Commission. It relates to a vesting zone change for the construction of a commercial center, the Beverly connection in CD5.
Hey,
Okay, can I have a report from the department, please?
Good afternoon, Councilmember Reyes, Councilmember Weezer, and welcome to Councilmember Koretz. My name is Jim Tokunaga. I am the staff with the City Planning Department. This item before you is the zone change ordinance for the Beverly Connection site. The zone change is for a TQC21VL, and what this zone change does is it cleans up the entire site from a 20-year-old zone change from 1989. The proposed project will add approximately 13,000 square feet to the existing Beverly Connection. Again, all it does is it cleans up the site and allows for the renovation and remodeling of the Beverly Connection. It's sort of outdated, outstyled, 20 years old. It's a considerably less project than what the Plum Committee saw 3 years ago, which included 2 high-rise towers. As of now, there has been no opposition to the project, and the City Planning Commission approved the zone change back in May. That's it for staff. Unless you have questions?
Okay, would you like to ask questions or hear from the public first, Councilmember?
Hear from the public.
Okay.
I don't think we have many questions.
Well, let's hear from public comment, then we'll have discussion. We have with us Laura Lake, Harold A. R. Hahn, and Catherine Casey. Come on up. Good afternoon.
Good afternoon. I'm Laura Lake, and I'm very pleased to be here in support of the revised project. It's the result of a lawsuit settlement, which we hope we don't have to go that route very often, but it's a very good outcome for the owner and for the community, and we have always supported the remodeling of this project. We hope that it's a very successful commercial development. Thank you very much.
Thank you, Ms. Lake. Next speaker, please. Good afternoon, sir.
My name is Harold Hahn, 479 South Sherborne Drive. We were the litigants that caused this project to be changed. We are supportive of the project at this point. We hope that it will be a successful project. On my walkthrough the other day, I saw that already more people are visiting this project than used to in the past. This, unfortunately, was a failure of the city. This project should have been completed 2 years ago. There should not have been litigation necessary had we had the support of the planning department and of the city council. Hopefully, in the future, the community will be allowed to enter into projects more than it has in the past. As it stands, we support this project fully. We think it will be a benefit to the community. Thank you.
Thank you, sir. Catherine Casey.
Good afternoon. Catherine
Afternoon.
Casey with Craig Lawson and Company, 8758 Venice Boulevard, Los Angeles 90034. So we represent the applicant BevCon 1. We're just thrilled with the community support. We received 9 letters of support, including from the Mid-City West Community Council, the Miracle Mile Chamber of Commerce, and the 3rd Street Business Association. We support and concur with the determination from the City Planning Commission, so we're pleased with that.
Okay, thank you very much. Councilmember?
I would just say, coming in late in the process, it seems like at this point it's a win-win with all the community groups and opponents all supporting the project.
I'd like to move to...
So I'd move the item.
Okay. Is there a second? Second. Okay, so we will move this item, and Madam Attorney, any special action we have to take on this one? So we just move in second and have it in council by when? Barbara?
Was there a requested date? We have until the September the 11th. So do you have a requested date you want to announce?
The sooner the better.
Next week, next Wednesday.
Okay, because that'll be the action of this committee. Okay, thank you very much. Okay, Roberto, next.
Next, council members, is a status report from various city departments relative to the proposed medical marijuana ordinance.
Okay. Let's go, planning staff, come on up.
Oh, let me clarify, it's a week from tomorrow, not tomorrow.
A week from tomorrow.
Yes.
All right. Okay, planning staff on this item, please. Good afternoon.
Good afternoon, members of the committee, and welcome to Councilmember Koretz, Alan Bell, Planning Department staff, and we're here to provide a status report on the approach that the Planning Department is going to be taking on developing the permanent medical marijuana regulations. At the last committee hearing on this particular issue, we addressed it, and we received specific instruction from this committee on the particular direction to take. We have assembled a project team within the Planning Department consisting of members of our code studies staff and also GIS technical analysis to help us with the data requirements to prepare the ordinance. What we are proposing to do is to create a land use ordinance, and specifically we would see that this land use ordinance would be within what is called the public benefit provisions of the zoning code. This particular set of provisions has some unique advantages, which I will explain very clearly right now. It allows us to establish by right operating standards for medical marijuana facilities, but it also allows us to require a public hearing, notification within 500 feet of the neighbors for those medical marijuana facilities that do not meet those particular standards. So, in short, we would allow on a by right basis those facilities that meet the standards, those that don't meet the standards would require a public hearing and full discretionary review before the public, and ultimately a hearing before a city planning department appointed hearing officer with an appeal before the city planning commission. So that is the basic structure of the ordinance that we're proposing. The ordinance itself would have the specific zones where these facilities would be allowed. We would identify the very specific operating standards that would be enforced by the Department of Building and Safety. The ordinance would also have a number of distance and separation requirements, and we see that there would be three categories of those requirements. Number one, we would see a distance requirement separating one medical marijuana facility from another one. Number two, we would see a distance requirement separating these facilities from sensitive land uses, specifically the types of uses where children may tend to congregate, such as schools and parks. And then the third distance requirement would be to separate these from those uses that potentially can create additional nuisances. For example, a distance requirement separating them from liquor establishments or adult entertainment sites. So those are the variables that we would be playing with. We would also introduce into the analysis the notion, as was raised at the last hearing on this matter, providing some conditions and some standards to look at whether they should be located near medical facilities. Again, just to recap, there would be a 500-foot notification to the public for any particular medical marijuana facility that would not meet the standards. And we would be supporting the development of this ordinance through very detailed technical analysis. Our timeline for this is to have the technical analysis completed within September, with an ordinance that would go before the Planning Commission in October. I want to now also introduce the project manager for this, Helen Bibas, and she can provide you with more detail as to the approach that we are taking for the technical and geographic data analysis on this particular important project. So let me introduce Helen Bibas right now.
Good afternoon. Good afternoon.
Good afternoon.
I don't want to burden you too much with too much technical information here. Yes.
Speak into the microphone, I can hear you better.
Like this?
There you go.
Is this better?
Yes.
Okay. I was starting by saying that I didn't want to give you too much of a technical analysis of where we stand today, but essentially we are trying to plot all the information that we will need to formulate recommendations for policies guiding the establishment, the siting, the location, and the protection of sensitive uses whenever we come up with new provisions for locating dispensaries. We intend to analyze every community planning area, that's 35 of them. We will be looking again at sensitive uses, mostly areas where children congregate, from libraries to school to daycare centers to recreational facilities and so forth. And we'll try to come up with several scenarios and offer recommendations when the time is appropriate. I'll be happy to answer any questions you may have.
In terms of the data that you're using, are you using 2000 data, year 2000? How recent is the data that you are using for this analysis?
It's actually fairly recent. The oldest data set that we have is from 2007. And
2007.
we are in the process of updating that. We hope to bring all our data sets at the same age, so it's all consistent, and we hope we'll be able to update this information periodically. We also want to set it up so that the Department of Building and Safety, or whichever other department is going to monitor and play a part in this whole program, that they will be able to pull this information out of our ZMAS and Navigator systems.
When you look at the amount of time you need to present the set of maps that will give us an idea of where these locations might exist, is that within weeks? I hope.
I hope so too. It's very tedious, and no set of data is the same as the other, and no community has the same type of problem than the others. So we are diligently producing those maps. Couple of weeks we'll have a better idea of where we stand. Again, it's just a sheer volume of data and multiple projects that we all work on.
So maybe in a couple of weeks you can tell us how far you've gotten so that we can see what kind of traction we've actually been able to complete and see what has become more evident. So perhaps you can come before this committee in 2 weeks and see where we're at. Okay. Any questions from the planning department regarding the mapping and some of the details on this ordinance? Seeing none. Thank you very much. Next, I'd like to ask perhaps the CLA with the collaboration, I believe. Before we go there, yes, let's have the CLA staff, Mr. Hahn, come on up. And
yes, good afternoon, council members. Hahn Dow from the Office of the Chief Legislative Analyst. As you're somewhat aware, the proposed regulatory scheme that is being analyzed right now has dual components to it, the land use component, which is being worked on from the planning department. We are continuing to work on the operational requirements of the regulatory scheme, and in that light we've met with the various departments and offices that would be affected or would be participating in the process that's being proposed. Based upon the feedback and additional information that we've gotten from the proposed ordinance that was introduced at the last plum hearing, we've revised and have sent out to the various departments a revised draft to what was introduced last time. And so we are awaiting further comments from the various departments and offices. We have been able to meet with the criminal division side from the city attorney's office and incorporated their input and comments into the revised draft that we have sent out. However, the transition from the city attorney's office, as you're aware, has caused some delays in getting input and guidance from the city attorney's office in trying to finalize the final framework for the ordinance. And so we anticipate that maybe in the next few weeks we'll be able to meet with the city attorney's office and try to get the final ordinance framed out at that time.
I think it's significant. I mean, the attorney got sworn in past week.
Yes.
And
yes.
I know there's some settling and management issues and all that good stuff. So hopefully next week or two we could get a stronger focus and feedback, and I'm sure they'll be there. So I thank you for being the current gatekeeper at this time, but I appreciate the coordination. Any questions to Mr. Dow? No? Yes, sir.
Oh, I'm sorry.
I'm not sure if you're the right person to ask this question of or not, but I know we have a policy now of starting to hear some of the hardship cases. A question generally, I'm not sure to whom I should address it, is does it make sense for us to be hearing these cases and shutting down places that we may find 2 months later might be in the right zone and be able to stay open by right?
I think the city attorney's office has been advising with regards to if you're talking about the hardship exemptions, and I would defer to the city attorney's office on that.
Jerry Burge, City Attorney's Office. I think that's a policy question for this committee and the council to decide whether you want to grant a hardship exemption, whether you want to continue a hardship exemption, whether you want to deny a hardship exemption while you are still looking at permanent regulations. It's going to take probably months before those permanent regulations are final. And in fact, the interim control ordinance has now been extended to potentially, I believe, March 2010.
So what do we think a rough timeline would be if we had to take a stab at it to the point in which this new ordinance actually goes into effect?
Well, there's, like what was mentioned, there is a dual component to it, and we're working to make sure that it coordinates and matches up with what planning is drafting on the on the land use components of it.
Well, I can tell you, we are pushing to have this in months, not 6 months. I'm hoping in 2 months, I'm hoping within, 6 to 8 weeks, that's what we're shooting for. We still have to go through the process of CEQA and all the public hearings and all the good stuff that comes with an ordinance. So when you factor in those time frames, it takes us out about 2 months, almost 3. But we're shooting for 2 months. We want this done as soon as possible, but we want something that can be enforced. We want an enforceable ordinance. And that's why we're taking very stringent efforts to have each department bring forth their functions, understand their roles, so that when the ordinance is in place, it actually works. And we don't commit any errors or overlook any clauses that might create other loopholes or anything like that.
Well, I guess that's a question not necessarily for you in particular, but for this committee.
Yeah.
I mean, with the benefit of 20/20 hindsight, we might say, okay, I wish we could go back a year and rehear all these hardship cases and shut them down then. But we're where we are now. So if we're 2 months away from having an ordinance in place that might very well say, okay, X number of these places are fine where they are and they could stay in, does it make sense to put them through the process of shutting them down?
Well, I think it's
just to give them the opportunity to reopen in a short period of time.
Well, each case has to be analyzed for their specific conditions, and we're putting a lot of weight on what the council member sees, feels, how each councilor is reacting to their constituents. And so these hardship exemptions offer us the opportunity to hear from each policymaker of those respective districts. And that, I think, is a significant weight when we are making these assessments. So we do have the advantage of being able to assess each case that way. But you're right, it's very well may be possible that there might be locations in which some are allowed, and there might be some overlap there, but it's too hard to tell at this time.
Okay.
Any other questions? Okay, any other questions, Councilmember? Correct? Okay. Thank you, sir.
Thank you.
Next, I'd like to call up the Building and Safety Department. Please introduce yourself, sir.
Good afternoon. My name is Frank Bush with the Department of Building and Safety. I'm the Assistant Chief of the Code Enforcement Bureau. And I want to mention that we are going to be dealing directly with everybody involved in the committee to get the ordinance completed. Providing input to them, to all the members of the committee. I just wanted to give you a little update on, we've had a lot of questions regarding the enforcement of the medical marijuana dispensary complaints that we received. We respond to the complaints that have been submitted by the community members, neighborhood councils. We've been working with the neighborhood councils and the community members to address the issues, their complaints that come through. We're issuing orders if they are in operation, and we are waiting on some of the orders for the hardships to be heard. Recently, we've had 15 that were denied by the council, the full council, and those we have issued orders to or in the process of completing investigations on them. Some of them, we have about 5 of those that have been closed. 6 have been moved along to further enforcement with the city attorney's office, who has, the criminal division has been there dealing with these cases, been involved in attending some of the Plum Committee meetings and staying involved with it also. And on the 29 that were just denied by the Plum, we have gone and made sure we have orders issued on all of those that are in operation. We have a number of them, about 5 or 6 of those are closed, so we aren't going to have to take any action on them because they either didn't open or they have shut down since their denial. And then we'll be waiting for the council to hear the remainder of those hardship exemptions in council, and then we'll be taking further enforcement action on them. So,
Great.
Do we have any questions?
I don't have any questions, but thank you again for, I've seen council members show me pictures of the orders posted on doors and that they have been shut down, so I appreciate the follow-through and the efficiency of how it's being followed up, so I appreciate that very much.
Okay, thank you.
Any questions? Seeing none, thank you, sir. Okay, I believe that covers most of the departments. I do want to make sure that we continue this collaboration with the CLA and the City Attorney's Office and all the city departments. Appreciate the CAO's effort and the relevant departments to develop a fee study with regards to administration, implementation, enforcement of the new direction of the draft ordinance. So as we continue to meet, these different elements of this ordinance should be put together, so we'll continue working there to meet that objective. So hopefully we'll get a report in a couple of weeks to see how far we've gotten on this process. We will go through public hearing cards. We have Don Duncan and Zuma Dog. Good afternoon, sir.
Good afternoon, Mr. Chairman, committee members. My name is Don Duncan. I'm a resident of Los Angeles and the California Director for Americans for Safe Access. And I want to thank you for moving quickly now on the ordinance. It is very important, and my hope, of course, is that we'll be able to finish this as soon as possible, perhaps even before September 14th, when the original moratorium period expires. It's important as we move quickly that we make good recommendations to the to full council about the provisions. And so I just want to mention very briefly two of those recommendations today, and of course I'll be following up and with additional communication to the committee members after this. One is the unreasonable restriction between for a medical marijuana facility to be located near a laundry list of sensitive uses. Adult uses for adult entertainment have a 500-foot exclusion under city code for schools, churches, and parks. We're anticipating some well-operated, well-regulated medical marijuana facilities, but requiring that they be located 1,000 feet, twice as far from a much wider wider list of sensitive uses. And I hope that the city staff and the council will give very careful consideration to the kinds of institutions that are anticipated by this ordinance. There's no need that they be located away from such a wide list of sensitive uses. In fact, I think what you'll find with the analysis of the maps is that it's simply not practical to have that sort of an exclusionary zone. Secondly, I want you to be very careful about patient privacy. The current draft calls for medical cannabis collectives to disclose the patient cultivators who supply medicine in advance to the police department. And this is problematic for two reasons. One is that it presents a risk to patients for their privacy and for undue enforcement, either from the federal government or from rogue law enforcement elements right here in Los Angeles. It's also problematic, however, because the type of organizations that are legal under state law are patient-supplied collectives, and that requirement anticipates that these facilities will be operating illegally by purchasing medicine from suppliers on the black market, and we want to make sure that our ordinance reflects the way that the law is intended to operate. Thank you very much.
Thank you. Councilman Sir.
Can I ask you a couple of questions?
Of course.
Thank you very much.
Let me just ask him a question. The notion of privacy is going to be a delicate balance for us, because on the one hand, we want to make sure we're not furthering a sub-economy that deals with illegal drugs, on the one hand, while capturing that opportunity to provide medical marijuana for those who need it. And so creating that veil and that envelope where that can occur is going to be one of our greatest challenges, I believe. So we're going to need to work with you and your group and those who are involved with those issues, because that is a delicate balance we have to achieve. We don't want to be a city that's going to be furthering illegal drug trades, either domestically or internationally, but yet we are dealing with a very significant issue of a medical treatment.
Yes, and requiring that the collectives and cooperatives be self-supplied, which is the model anticipated under the state law, that is, they're supplied by their members for their members, certainly addresses the concern about avoiding entanglement with the illicit market. But disclosing that information to law enforcement sets up a situation where we could have people facing prosecution or investigation that's not warranted. Remember, if we're requiring that these organizations function in compliance with SB 420, there should be no need then to turn over the membership list to law enforcement for specialized attention for certain patients.
So we should be talking more as we go through this process.
I will certainly email and call about that in the future as well.
Thank you. Councilman Reese, I apologize. Go ahead.
Thank you. That's fine. A couple of questions. One is, I'm actually rethinking my own thoughts about where we allow these facilities to be placed, because I went to a facility in Eagle Rock that didn't have a sign, didn't say what it was. Obviously, the customers who were going, legitimate customers, knew where it was. But if run correctly, I mean, we shouldn't be concerned about these facilities being closed in proximity to sensitive uses, because if run correctly, and if they cannot consume the product on a premises, and if this product is being legitimately used for medical purposes, we should not anticipate many problems around these facilities. So I'm trying to think through the 1,000-foot distance from sensitive uses as well. I think we shouldn't be as concerned with that. That's one of your points, right?
Yes, I think you're correct about that. And I think the sorts of facilities that are problematic close to sensitive uses may also be facilities that simply are not going to be in compliance with the other provisions of the ordinance.
Exactly.
So I think your well-regulated collectives that are willing to play by the rules and do it right aren't going to be a problem for certain locations.
Okay. My other question to you is, assuming we do everything correct in Los Angeles and we have a great ordinance and we're happy that we're able to provide those who need medical marijuana, this product, but there still remains an issue where there are doctors who are freely giving out these prescriptions. I've heard it's fairly easy to get these prescriptions to perhaps people who don't necessarily need medical marijuana for medical purposes. Are your organization doing anything on that front to address the issue about how the medical profession, perhaps the state medical board, could get involved with talking to their doctors about appropriately giving out these prescriptions?
That is a big controversy in the state of California right now, and the California Medical Board is investigating doctors that they believe are violating the standards they've established for regulating for recommending medical cannabis, rather. Unfortunately, the city doesn't have a direct role to play in that process because the Medical Board has the enforcement authority, and some doctors have been punished. I don't know if there's a sense of the council that they wanted to speak up on the topic, whether that be through a resolution or another communication in support of that California Medical Board effort. But unfortunately, I don't think there's anything the city can do officially to push that process forward. But it is occurring, even if very slowly.
Thank you very much. And I think we've got to approach this issue from all levels because there are people who still don't believe in Proposition 215 or that medical marijuana should be allowed. And this city has opted to make it available. Other cities have not. But if we don't do it right, we're going to fall into, or the people who oppose us are going to point to this and say, you see, it's out of control. We're going on a path of being out of control given the number of facilities which just popped up without any little or no regulation. And so we have to approach this very carefully to make sure it is done right, because any signs of having this out of control, whether it's the medical doctors who give these prescriptions freely or these facilities causing more problems in neighborhoods, we could regress in terms of putting the public opinion fight that this should be allowed for those who medically need it. And it's just something that I hope the organization is really looking at, because we want to make sure that we do this right so that people don't point the finger, and then who knows, we might pull back and say we will not go in this direction.
Oh, yeah, we're certainly very interested in helping ensure that this process in Los Angeles goes more smoothly from this point forward. I think the public relations problems that we've seen in response to the continued proliferation of facilities here in Los Angeles has certainly been very undesirable, and we're very committed to reversing that process.
One final point. I don't know the chemicals of marijuana, but I've been told, and those public speakers who came to tell us, that to get the desired medical use of marijuana, that it does not necessarily have to be smoked. That could be ingested other ways. Has your organization taken a position on that, or do you guys pursue that, or have you guys talked about it?
Yes, we do try to educate our members and the public about the alternatives to smoking cannabis, which is primarily edible cannabis. There's also an option to vaporize it now, although that's a more expensive option for some patients. And so it's very important that the ordinance recognize, or the policies of the city recognize, that people may not be smoking medical cannabis. And edible preparations are a very, very important part of ingestion for patients who can't smoke or won't smoke.
Okay, thank you.
Thank you.
I would just point out, I was actually one of the original co-authors of the state enabling legislation, but there are a lot of things that I never really anticipated. One was the fact that I could probably go to a number of doctors having no conditions whatsoever that would be at all relevant, and I could probably come up with at least a few prescriptions. So clearly, the process is not working the way I envisioned, where one could come up with a minor allergy and get a prescription. This was certainly my intent to particularly help people with significant chronic, mostly life-threatening conditions. And I have known people who are still alive today that have fought HIV and AIDS for 20 years, and they're alive because of access to medical marijuana. So it's important at the same time, you have a lot of folks that shouldn't be getting it, you have a lot of people writing prescriptions that shouldn't be writing them, and you have a lot of facilities that are not handling their role properly. I just got a call this weekend from someone at 7 in the morning saying there's 40 people lining up outside a new medical marijuana dispensary, waking them up, engaging in a lot of loud and annoying behavior, and the place still wasn't open, and it's certainly a nuisance to that neighborhood. These kinds of things have been going on off and on, and we have to find a way to address them and allow the people that really need access to this access at the same time.
Thank you. We do have one more speaker card, Mr. Sumit Doug.
Yes, thank you, and it's a pleasure to speak with the three of you. I know that you're very mindful about this, and you're really taking a lot of time. I appreciate it. I respect all three of you in this category here. So first of all, edibles. Jose was talking about the edibles, very, very important. People think about the marijuana, the smoking of it. Please, edibles are very important. Some people can't smoke, and it is a different effect, and it's a very important thing. And some people, I'm sure they live on the edibles, especially people with very, very bad pain. And so that's very important. Also, I noticed the hours, 8 p.m. I noticed you have the hours 9 a.m. to 8 p.m. Well, if somebody has to be at work early in the morning, by the way, most of these dispensaries, they don't even open till 10 or 11 at the earliest, so you have to be at work. Then if it closes at 8, I mean, seriously, doesn't matter to me. I can make it at any time, but for a lot of the people, 8 might be too early. Names of all registered members, the grows disclosed to LAPD, that sounds really bad, and I appreciate the need to be on top of, where this medication is coming from and measures need to be taken. I'll be talking to you about some ideas regarding tracking and things like this, but that's a real flag to me. And also regarding the sensitive use with the 1,000 feet or whatever, really, again, to back up what Don Duncan said, if you're operating compliantly, it shouldn't be a problem at all. Nobody has a problem with CVS Rite Aid for, Ritalin, Prozac, OxyContin. It just comes out in a little bag and nobody complains. Well, medical marijuana is not as bad as that, and it just comes out of the same bag. It could be jelly beans. And if for all this bad behavior around the co-ops, well, if that's happening, then LAPD knows exactly where to go to round up criminals. If you don't say shut down 7-Eleven because people are buying beer and drinking it a little bit too close or diverting the beer, you crack down on the activity. I think you should beware of saying no to all hardship exemptions. Some other things. Ed, I like you said, something that can be enforced, something that's enforceable. Get something on there, because if I could just have a little bit of time here to say, the most importantly, if you just put some laws down, a lot of these co-ops are not going to be able to comply. It's going to be too difficult. The way they acquire the medication, they're not doing it properly. They're not going to be able to do it. So if you just get something in there, that will thin the herd in itself.
Thank you very much, sir. That concludes public comment. So we will be expecting an update status in a couple of weeks, and let's keep working together, and I appreciate your hard work and this effort. So that moves us to item 14, but let me just take a 5-minute and I'll be right back.
Need one? You want to test it? Oh, you don't have a card.
Oh, okay. We don't care about Rich. He's not in our office, so we don't care.
That was 5 minutes? She said 5 minutes. Yeah.
Somebody who actually wanted to go to your meeting.
I'm about to say, so we haven't sent that. So that, yeah, we.
Maybe same name, but different person. Yeah. Yeah.
It's like, what is he talking about?
Okay.
We'll work with that. Okay. Right. Okay. So colleagues, as we've heard from our staff, I think what's critical is that the maps that we will see will give us a greater sense of location, and we'll start working with certain variables of sensitivity and back and forth. So that was the last item. So I just want to make sure I close that loop with that comment. So that being said, Roberto, what's next?
It would be item 14, Councilman. It's an application by Daniel Halbert. It's a hardship exemption from the medical marijuana ICO for Best Bet located at 12515 Venice Boulevard in CD 11.
We don't survey, right? This was continued, am I correct?
Yes, Council.
From the last hearing?
Last Monday's special meeting.
Okay. Good afternoon, sir.
Good afternoon. My name is Robert Gravich. And I'm an attorney for Norton and Melnick, and I represent Mr. Halbert and Best Buds. I was at the first city council hearing where the first applications were heard, and from what I recall, the city attorney and the city council indicated that there must be fairness and rationale in either denying or approving these applications. Here we have a case where Mr. Halbert obtained permits and obtained licenses to operate a collective. After getting those licenses, he went to the city, filed a hardship application. On the hardship application, it doesn't say he can't operate. No one at the city told him he couldn't operate. From that point, he goes and gets a lease. From that lease, he spends $100,000 into his collective and operates. Well, he filed his hardships in December, gets absolutely no indication from the city that he can't operate until just recently when he gets a 72-hour notice that there's going to be a hearing upon this application. But in that period of time, for those months, what's happened is he's built a collective that's created compassion for his patients. The patients support the collective. What's happened is that the patients have emailed the city council. The patients have written letters to the city council in support of this collective. Also, there's been support from surrounding businesses in the Mar Vista area. There's been support from the neighborhoods in the Mar Vista area. There's been utter support from the patients, and that's really what's the most important thing here. In addition, there's absolutely no sensitive uses surrounding this collective. No schools, no parks, libraries, nothing of that nature. This is a collective that was created under this is a collective that is the epitome of the Compassionate Use Act. And when we talk about fairness and when we talk about a rational basis, denying this hardship will do what? It will take away from a substantial amount of money that's been expended in this collective, and it'll take away from what the patients have as a safe haven for them to obtain medication, which they truly need. It will also take away from the community which wants this collective, and most importantly, it takes away a collective from the city of Los Angeles, which is a perfect example of what a hardship is and a perfect example of why this law was created. Thank you.
Thank you, sir. We have Daniel Halbert.
My name is Daniel Halbert. My address is 11909 Palms Avenue. Yes, I relocated from Phoenix, Arizona after making 3 trips out to do my due diligence with the medical marijuana program. I saw hundreds of dispensaries opening up under the hardship, and I paid legal counsel $3,500 to walk me through that process. From the beginning, I was committed to running things differently from what I saw. I did see a lot of very poorly run dispensaries, and I wanted to be an asset to our community. I've been in business all my life, and I'm somebody that people like to do business with. I'm a win-win type person. Now the community is paying me back. I've had over 100 letters written from people in my community. I did, after our last meeting, go out and speak to 30 neighboring business owners to find out if we were causing them any problems, and most of them signed my petition saying that they liked me, they liked our business. It's a beautiful facility. So I've gotten no real negative feedback. 2 didn't want to sign because they weren't really familiar with the issue. I've created 7 jobs. I've spent $100,000 at Home Depot and furniture stores, making a really nice, safe environment. And I'm asking for a 6-month extension until you do get the final ordinance figured out. I'd love to be a part of that process. I have some good ideas also. Please don't throw out the good with the bad. I am very committed to, as you are, the responsible dispensing of medical marijuana in our communities. I know of many other dispensaries that are causing problems, and I would love to be a part of helping solve that problem. I'm very encouraged by what I've heard you gentlemen talking about today, and again, would like to be a part of the solution.
Thank you, sir. Thank you very much. Someone began to fill a card out but didn't put their name on this one. Anybody remember thinking they were going to speak and didn't put their name down? If not, we'll just move on. Our last speaker is Zuma Dog. He's not here. Okay. Don't see him, so we give him a lot of time. Let the record show. Our next speaker, the council office, please.
Maybe I didn't write my name on the card, quite possibly. Good afternoon, council members. Whitney Blumenfeld for Council Member Bill Rosenthal's office. We have also received letters dropped off on the councilman's front doorstep, actually asking for the hardship exemption for this location to be denied. The applicant failed to demonstrate any hardship from the provisions of Ordinance 1790207. As the applicant has not demonstrated any hardship, the council office urges the Plum Committee to deny the hardship exemption application. Thank you.
Were you aware of the support letters as well?
Correct.
Okay,
Yes.
so, all right. Colleagues, any questions?
Just motion to deny the hardship exemption, and there has not been any evidence shown that a hardship exists on this case, in this matter.
Okay. Have a second?
Mr. Chair, could you go over again for the audience and perhaps for me as well, exactly what basis one could find for this hardship exemption? What's the logic behind that even being an option?
I'll ask the city attorney to answer, please.
Jerry Burge, City Attorney's Office. A hardship exemption is a legislative act, and so it's for the council to determine where the hardship exists. And basically what that means is that you need a rational basis. Traditionally, what the council has looked at is whether or not there has been some detrimental reliance prior to the new law, so that it would be unfair to apply that new law in a particular particular situation. You might look at whether or not somebody had spent a lot of money and done a lot of things before the new law had been adopted. Also, always with the hardship exemption, you are not entitled to open by merely filing a hardship exemption and then pleading the fact that you've been open. You apply for your hardship exemption, wait for it to be approved, and then open.
The assertion from one of the speakers is that in their forms it does not indicate that you cannot operate. Does that hold any weight in terms of?
Councilman, in our view, to use a legal adage, ignorance of the law is no excuse, as everyone's probably always heard, but the law was on the books. And also, there's a frequently asked question document that the planning department produced quite a while ago. And you have to remember that the ICO has been in effect now for quite some time. And this frequently asked questions document does say, in answer to the question, can I operate, the answer no. So that information is certainly available.
Okay. Councilmember, any other thoughts or questions on this?
No, I don't think so.
Okay, I'm sorry, sir. So motion's been made. Is there a second? I'll second the motion. So that'll be the action of this committee. The hardship exemption will be denied based on the evidence and comment from the council member, and based on the application submitted, public comment today, the applicant cites lack of awareness of the requirement to register amongst the reasons which does not demonstrate a hardship from the provisions of Ordinance 179027, including but not limited to reasons the applicant is able to register with the city clerk pursuant to Section 3 of the ordinance. Therefore, we move to deny the hardship exemption application. Okay, over to the next item.
It's item 19, Councilman. It's a status report from the city attorney as it relates to various pending litigation. And I think you have the option to go to closed session.
Okay. So let's go to a closed session on this item. And Madam Attorney, I can ask for.
A status and update related